So first of all, let's talk about IMT or internal medicine training. So internal medicine training is post-foundation training, which 3 years program. I think after that, there's completion or entry to higher specialty program. So today, let's speak about the eligibility criteria for IMT training. So first of all, I think we have IMT or internal medicine year 1, which includes assessment of acute ill patient and management of acute medical intake of patients. We have internal medicine year 2, which includes experience in outpatient clinic. And lastly is IMT, internal medicine training year 3, which is primarily involved in acute take and functioning as a medical registrar. So what I heard is the 3rd year, you have like supervisor, they will supervise you as a medical registrar. All right. So myself, I got an offer in 2024, which is going to be started in August this year, inshallah. So in 2024 IMT requirement, it was just 1 round. So the application was open 26 October 2023, and it was closed 23 November 2023. And please be noted that there was no round 2 on this year, because IMT, as you know, guys, is getting very competitive. So it was just 1 round. So let's talk about the application process. First of all, to apply for internal medicine registration, you need to have ORIO account. You have to upload the ORIO account. Second is application registration. So application registration is, for example, you need to show that you are completed FY2 or currently training as FY2, which means you need to have 24 months experience before you apply IMT, which means myself as international IMG or international medical graduate, I did FY1 and FY2, which is 24 months of experience. The other thing is, it's not necessary that you have NHS experience or not. That doesn't mean you are if you have NHS experience, you are eligible or not, which means you have to have 24 months experience, which means simply you have to complete FY1 and FY2 before you start your training. The other thing is you have to read about vacancy requirement programs of IMT. That's the other thing is there's evidence page, which give you an overview of what is required in terms of documentation for achievement claimed in the self-assessment section of your application. For example, the evidence page include a range of documents like a certificate or letter confirming that your invitation or delivery for presentation, and if you do audit, like a copy of presentation, slides or poster that you did, all teaching, audit, presentation, everything, there's evidence based, you have to upload there. The last one is scoring criteria. I think which is Zainab is going to speak about it, but let us see as general the scoring criteria. The scoring criteria is you have 2 scoring criteria. One is the scoring criteria for portfolio session, and there's scoring criteria for general interview or when you invited for interview training, they will score you, and after the scoring, you will get your rank preference. So at the interview part, we will speak about more details about that. So first of all, guys, let's speak about portfolio station or interview parts. For interview parts, first of all, when you apply the registration, you have to have portfolio. You have to have a good portfolio or a strong portfolio, which means you have to have scoring criteria, like you have to do, or if you did the audit, if you do teaching, if you do presentation, if you do quality audit as well, all the things, they will give you some few points. So you have to score yourself before you apply your registration. I think the last year cut point was 15. So I will explain more about that later on, scoring criteria. So when you apply that for international medical graduates, you need CREST form 2024, which I did. You have to sign one of consultant, he or him. You have to sign your CREST form. So when you apply, they will assess your criteria. If you get the right criteria, then you will be invited for interview. So on the interview part, you have to book your interview slot. So let's talk about the interview parts. So first of all, we have a lot of tips and tricks on interview parts. On interview parts, you need to improve your interview skills and prepare good answers to common questions. We generally think, normally we think that a strong application will land us a good ranking, but it's mainly how your interview goes on. Interview is a common skill, which we have commonly ignored. So it's all about interview nowadays. If you interviewed well, if you did good in interview parts, I think you will be fine the rest. So let me talk about interview parts. Somehow, for interview tips, it consists 4 questions. You have portfolio station, you have clinical station, you have ethical station, and you have 2-minute presentation. So for interview parts, you need to have for portfolio station, they will ask you previous what did you do, like if you did a presentation, talk about what you did before, like strong portfolio application. For example, if you do audits, if you do presentation, if you do some teaching, you will speak about all that things. You will speak about your CV as well. So like here for portfolio station, you have to do introduction, achievement, audit, leadership, presentation. For example, MRCB is not part of the assessment criteria, but it will give you like commitment that you are interested to do IMT. So foundation competence, commitment to specialty, which is basically MRCB, for example. So guys, for interview parts, first question, it was clinical scenario. For example, they will give you clinical scenario case. Let's say patient, they will give you scenario like patient came complaining about chest pain and like shortness of breath. So they will ask you a few questions about that case. For example, they will ask you about differential diagnosis, investigations, management plan option, and you have 1 minute to hand over your colleague to the case. So basically, you have to be organized. You have to be a safe doctor. For example, if the case is emergency, you have to like be organized, like start about ABC. So the other thing is, you have to, they will assess you if you are a safe doctor or not. When are you going to call for help, your colleague? And if it's like difficult case, you have to involve your seniors. You have to hand over to them. You have to ask them. You have to escalate that problem. You have to ask them for help. I think that's for clinical scenario. The second question was 2-minute presentation about, you have to talk about your portfolios, your portfolio, what did you do, like audit, as I said before, teaching and stuff like this. This was the second one. The third one was it was portfolio station. It was sorry, can I go? Yeah, it was ethical scenario. So for ethical scenario case, it's like medical error. They will give you, for example, if you discharge, for example, let's say you discharge one patient and the patient miss out, like the outpatient appointment didn't went through. So what are you going to do? This is the question. The other thing, for example, if you see one patient have been treated, what are you going to do? For example, you have to escalate, you have to do datics, you have to do safety care and stuff like this. That's the ethics station. I think the ethics station was the difficult one. So you have to read GMC, good medical practice, for the ethical station. The other one, it was the other question, last one, it was, why you interested to the IMT training? You have to tell them why you interested, why you apply this position and stuff like this. It was like easy. But the thing, the heavy mark, it is on clinical scenario case and ethical case is the major one. So you have to be well prepared of that. Okay. So what I'm saying is, on my interview preparation, I studied clinical, Oxford, good medical practice, and medical interview book, and I will be highly recommended to do the interview very well, because I think for myself, my portfolio, it was not that good, but my interview part, it went well. So you have to be well prepared. You have to be well prepared on your portfolio. For interview tips, what they're assessing is to be a safe doctor. The people interviewing you are consultants. They are looking for candidates they can trust to be. They can trust to be on call or look after their patients. So, guys, they want you to know that you can think under pressure, that you make decision while not overreaching yourself. They want to see that you know your limit and understand when it's right time to call for help. And be polite and well prepared on interview parts. So let me talk about little parts on scoring criteria. So for IMT, for scoring criteria in IMT, guys, we have two, which means we have application and achievement scoring, which means portfolio scoring. We have a score for portfolio and we have another score for interview score. So let me talk about portfolio scoring. So portfolio scoring, I think we have 5 scores, which means score 1, when they assess you when they are going to assess your score, they will give you either score 1, either score 2, 3, 4, or 5. That's the scoring criteria. So if they give you score 1, which means unclear or poorly structured presentation, means you are unclear or poorly structured, your presentation is unclear. If they give you score 2, So there's area for concern. For example, achievement, your achievement is below that the expected for experience level, personal circumstance, or little relevance to begin IMT trainee possibly. So unappointable subject to discuss and performance into another area. We have score 3, which means if they give you score 3 means satisfaction, achievement, experience level, personal circumstance, at least some relevant to begin in all, which means clear presentation. If they give you 4, score 4, that means good achievement above expectation. And if they give you 5, it's excellent, which means high achieving applicant, achievement above expectation, high relevant to begin as IMT trainee. So please try to have score 3, 4, or 5 in each session. Because if you get score 1 and 2, I don't think they will invite you for interview. So that's for scoring criteria in portfolio station. We have another interview score for general questions for interview parts, which is same. We have score 1 to 5. So let's see score 1. Score 1 means poor and not considered appointable, which means they are not going to invite you. They're not going to give you an offer. If they give you 2, so means which is same. There's area of concern, which means performed below level expected as FY2. You are not like FY2 level. If they give you 3, which means satisfactory, which means performance the level of FY2. If they give you 4, that's good. Perform a level at FY2 and you are suitable for appointment. If they give you 5, that's excellent, and they expected IMT above the level. You are above the level of IMT. So after you get the scoring criteria, I think the scoring criteria, all the portfolio and interview together was 80. So myself, I got 70. So I'm not sure. You have to get like 60, 65 and above like that to be safe. So all included, all together, they need 80. So if you get like 70 or 60 or 65, I think that's good score. So after you get you score, they will release a ranking preference. Like they will give you a form to fill out your preference area where you like to practice, like three area, like it's Milan, whatever, London, where you're interested. I think after that, you have to wait the ranking. After that, they will send you an offer, which means you have, I think, 4 options. You have to accept the offer, you have to decline the offer, and I think you have to hold the offer. Like for example, if you didn't get the area that you are interested, you have to wait. So later on, when the deadline is, when the holding period is finished, it will upgrade your preference area. I think that was my point. So let me give a conclusion what I said before. To be eligible for IMT or to apply IMT training, you need 24 months of experience. For example, F1 and FY2 include, like if you do FY1 and FY2, that means, which I did, that means 24 months. That's one point. The other point is portfolio criteria, which I said, and Dr. Zainab is speaking out. She's going to talk about that. Like you have to do some teaching, some audits, and stuff like that. And the other thing is you have to be well prepared for interview part. I think the interview part was the hardest one. So you have to be well prepared for interview. And after you do the interview, you have to get after you get the score that they need, they will invite you, they will give you an offer, and after that you have to put your ranking and your preference places, After that, you can accept the offer. I think IMT, it was this year, it was very competitive. So guys, you have to be careful. You have to do some audit, some presentation. You have to I think you have to be like hard it's like hard work, to be honest with you. Myself, as IMG, I did everything in Sudan. My course form being sent in Sudan. At the time I was applied, I think I was in the NHS like 3 months or stuff like this. The other thing is, myself, I did MRCB 1 and 2. I think that gave me commitment to apply IMT, because, for example, the questions or the scenario, it was like similar to IMT, to MRCB 2 or stuff like this. That's my opinion. But be noted that MRCB is not part of assessment criteria in IMT. I think that's all. If you have any question, you can ask me. Thank you.
Um, yeah, I'm actually the treasurer for the BSMA as well, so I might know some of you guys if you attended the conference. I may have met some of you there. So I'm just going to share my slides. Just 1 second. Let me just get things going. Can you guys see my screen? Hopefully you can see what I'm sharing. Is that coming up for you, Ramla? Can you see my screen? Or someone
Yes, I
can just give
can.
me a
Yes,
thumbs
I
up.
can. Just not.
Perfect.
It's not full screen.
Now is it full screen?
Yes.
It should be. Amazing. So yeah, firstly, I just want to say Mariam's presentation was so valuable, and I hope you guys were paying full attention, because those are exactly the kind of tips you want to make note of. The insider tips about how to succeed in the application process for internal medicine. It's getting more and more competitive. Every year, I think the application process is getting more and more competitive, and it's important to try and maximize the points as much as you can, not just in the application bit, but also in the interview. So I hope, I think we should actually have a dedicated session, inshallah, maybe closer to the application time, about focusing specifically on these areas. I think maybe today is more just about kind of giving you a general gist of what IMT is like. At least this is what I'm going to talk about a little bit today. But everything Mariam said is absolutely fantastic. Perfect. So my name is Zainab. I'm currently in IMT1, so I'm just coming up to the end of IMT1. And I'm just going to cover a little bit of the scoring criteria. I won't focus too much because Mariam's done such a great job covering it. There is a website that you guys can look at, and I would actually recommend you start doing it now. So it's nice and early. We're in July now. The application opens in October. So you've got plenty of time to have a look at the self-scoring bit, so you can make sure that you meet the threshold for interview. And there's a rubric that you can use, and I would use that as a guide so you can plan what you're going to do from now until the application opens in October. And really, you just want to focus on how you can maximize points, basically. Focus on the areas where you can maximize the points easily, and try to be as proactive as you can. Think of being creative about how you can actually get these things done. And you can reach out to us. I'm more than happy for anyone to contact me. I'll maybe put my email address in the chat about how to kind of make the most of the application process. So this is what the rubric kind of looks like when you go on the website. And it basically tells you exactly how many points are available for each specific section and what you need to do to get those number of points. And it's very, very clear, and I really recommend you guys to have a look at that. So I'm briefly going to talk through some of the areas. So the first one is postgraduate degrees and qualifications. So this is all about, the degrees that you had, prior to medical school or after medical school. So these are things like PhDs, masters. Now, this is an area that you might not be able to maximize much from now until October, but it's something to look at. You may have a degree. I'm sure you wouldn't forget that you have a degree, but it's just something worth looking at, but maybe not something that you might be able to maximize. Additional achievements, that's all about, how well you did at medical school. You might be surprised, they're very specific about what counts for those points. So they say specifically that you have to come at the top 18% of your year group. which is a very specific number. And you might be surprised, you might actually already have done that. So just have a look back at your medical school degree, and maybe reach out to your medical school and you can ask them. So there's small ways that you can pick up additional points. Presentations, that's a very good way to pick up points. If you've done an audit, find a way to present it. Look around for, local, you can do it locally at your hospital, you can even do it regionally. There's opportunities around. Ask people and see how you can maximize the section. Publications, that's an area that you might not be able to maximize from now until October. Have a look back. Is there anything that you've done that's publishable? Maybe try and see if you can do it, but it might not be something to focus on right now. Teaching is definitely something you can action. So definitely have a look at that section, because like Mariam was saying, you can deliver the teaching, organize teaching. That's something you can definitely do in the next few months. So have a look at that. And then quality improvement projects, that's also something you can definitely get done from now until October. So I would definitely focus on that area as well. And then there's leadership. Leadership is something that you can find ways to go about it. So in hospitals, I'm sure you guys know, there's usually a mess, which is like where all the doctors gather. Then you can kind of maybe apply for a leadership role there. There's also leadership roles within the hospital, so you can maybe offer to organize the rota. There's all sorts of ways to kind of get involved in leadership to maybe get a few points. You might not get the maximum points, but at least getting something will help you get over that threshold so that you can get that interview. So if I had to do this all over again, I would probably focus on these three sections, probably be the most valuable and the most actionable from now until October. So I think that's probably the most helpful thing to do in the summer and into the early October, like early autumn, is focus on ways that you can maximize your portfolio, ask the people around you to see if they can help you get those extra points so that you can get the interview. And then when you get through to the interview, you can focus on preparing for that as well with all the tips that Mariam gave. So yeah, I think that's what I would focus on right now. So hopefully that's helpful. And then we can maybe come back to this another day. We could focus specifically on this or something that might be helpful if people would like that. Great. So now I'm just going to talk a little bit about what it's like to be an IMT. So I'm going to focus a little bit on some myth busting, a general overview of what it's like to do IMT, what kind of activities you'll be involved in as an IMT, and then also how to make the most of your IMT and like what kinds of things you can get involved in and what opportunities there are as an internal medicine trainee, which hopefully you guys all want to do. So firstly, I think whenever anyone talks about IMT, I feel like there's a bit of a negative spin on it. I think a lot of people are starting to view it as a specialty that it's kind of a bit of a drag. It's like the gap between being an F2 and being a specialty registrar. So people often think it's a service provision role. You're just doing TTAs, discharge summaries, you're on the ward, you're dealing with social admissions. There's never anything interesting. It's endless ward round after ward round after ward round. That's kind of impression people get a lot of the times with IMT. But I've actually found it to be quite the opposite. I think it's actually been quite fulfilling. And if you try to find the positive in what you're doing, you can actually find there's a lot of value in doing internal medicine training. It's there for a reason. And it does give you a lot of opportunities to improve your critical thinking. You're dealing with a lot of complex patients. Often the most complex patients come to the medical take, and you're dealing with a lot of comorbidities. There's a lot of medical issues. We have an aging population. People are becoming, they're getting older, so they're becoming more complex because they're building up more pathology, and it gives you a really broad foundation. I think with internal medicine you actually cover a lot of different specialties, and it makes you, I think, a more well-rounded doctor. So I think IMT is, I think it's a fantastic way to kind of get you ready essentially to become a medical registrar. That's what it's there to do. It's there to improve your skills so that you're ready to become the med reg. And it's all about the IMT curriculum. So I think Mariam touched on this a little bit, but essentially you've got IMT1 and then it's followed by IMT2. And those 2 years are essentially giving you that broad foundation. You rotate through different specialties. You won't be able to cover all the specialties because there's only so much time. And in fact, when you, inshallah, get your jobs and you apply and you're successful with your interview, you'll be able to rank the jobs based on your preference. And you can rank them based on location, or you can rank them based on the jobs that you want to do. So for example, I want to do oncology. So I
So do
ranked
I.
the oncology I ranked the oncology jobs a little bit higher than some of the other ones. So you can be a bit selective with that. And then once you've done your IMT2, then you can choose to go straight into what they call a Group 2 specialty, which is a group of specialties that basically you don't have to do the medical reg role in the way that we know it to be. So you're not going to be carrying the take bleep, you're not going to be accepting admissions, you're going to be purely focused on your specialty. So for example, oncology fits in this, hematology fits in this, there's lots of different specialties that fit in this group. So have a look and see if maybe this is something you want to do. So don't be put off by the med reg thing after IMT, that it's not necessary, and you can avoid it if you don't want to do it. And then if you do want to do a group 1 specialty, which to be fair, I think includes the vast majority of the specialties are actually group 1. So things like gastro, cardiology, respiratory medicine, neurology, palliative care is even now a group 1 specialty. You have to do something called IMT3, which is basically an extension of IMT. It was kind of, I think they introduced it a few years ago. And you're essentially acting as a medical registrar, but you're still in that supervised role. You're being supported through that transition from being a core medical trainee to being a registrar. So it's supposed to help you transition into the role of the medical registrar in a more smooth way. But essentially, you become a medical registrar after you finish IMT2. That's the purpose of IMT1 and IMT2. So just going to give you guys a general overview of what sort of things you might be involved in as an IMT. So the first thing that you're definitely going to be involved in is the acute medical take. So I'm sure you guys know, if you've worked in a hospital, a lot of the admissions are actually under medicine. And IMT1 is essentially focused on getting you skilled in how to identify unwell patients, how to manage acute emergencies, and how to kind of review patients and understand which patients need to be admitted and how to deal with a patient that's deteriorating. So that's what IMT1 is essentially focused on. Then you move on to IMT2, and actually the bulk of medicine is not actually in the hospital. The vast majority of our patients are actually outpatients. So you see them in a clinic setting. So they're going to be well, and you're managing their conditions in an outpatient setting. And this is essentially, when a surgeon goes to the operating theatre, the medical doctor goes to the outpatient clinic. That's how it works essentially. And it's actually quite a nice way of working. So I would recommend, if you haven't already, to shadow a medical clinic. Go to a medical clinic and just see what sorts of things they do. And if there's a specialty you're particularly interested in, I would really strongly recommend that you get some experience in the clinic. I'm sure they'd be more than happy to have you there. So, and that will give you something to talk about in interview as well, to show your commitment to the specialty. So outpatient clinic is, another aspect of what you went do as an IMT, but more in IMT2. Ward rounds. Ward rounds are definitely something you cannot avoid in IMT, but I think you can sort of think about it in a different perspective, because as you transition into that IMT role, you're actually often the most senior person that's on the ward at any given time. So usually the foundation trainees tend to be on the ward, so F1s and F2s, and then you've got the odd IMT that might be on the ward. So this is your opportunity to kind of take on a little bit more responsibility and actually be that point of contact for your more junior colleagues, and support them in their decision making if there's something that they're not sure about, and deciding when to escalate to the registrar as well, because you're learning how to take on that role as well, and that's what it's there to do. So leading your own ward round and learning what you need to do essentially with that. And of course, because it's a training program, there are dedicated training days. I strongly recommend that you get involved in that. Make sure you take study leave. There's plenty of study leave in IMT. Make the most of it. They're actually now instituting something called, I think it's called self-development days. I don't know if it's in every deanery, but they're introducing it in my deanery. I'm currently in London. And we've got self-development days. Basically, you get 1 day a month, which is protected time, and you can do what you want with it. So if you've got an exam, for example, or if you just want extra time to work on your portfolio, if you want to go to a clinic, if you want to, I don't know, get some more experience doing a specific procedure or go on a course, you can use that time to do it. So realistically, IMT is a training program, so really try to make the most of the study leave that they give you. You're getting paid to have that study leave. Make use of the study budget as well. So yeah, you can really make the most of it when you're an IMT. And IMT, like I said, is essentially about developing those skills to become a medical registrar. So if you don't know already, in IMT, there's certain rotations that are mandatory, so you have to do them. and one of them is intensive care, and then the other one is geriatrics. And actually, if you think about it, those two are fundamental and really, really important to learn how to do well. So intensive care, you learn how to manage the deteriorating patient. You learn, which patients you need to escalate to the intensive care unit for a review. You learn how to do procedures such as inserting arterial lines and how to insert central lines. And sometimes, as the medical registrar, when you're a bit more senior, you might even be the only person in the hospital that would be able to do this procedure. So actually, it's really important to learn how to do these things and how to manage patients who are on a non-invasive ventilation, like that lady or gentleman, actually, sure, is on that in that picture. So it's really important to lean into these things and learn. And then also geriatrics. Geriatrics is actually incredibly important. People often think it's the boring specialty or whatnot, but actually you'll find that a lot of the patients that come on the medical take are over 65, and often they have a lot of medications, and it's about learning how to manage that and when, what medications to stop, what medications do what, how they interact, and those sorts of things. And actually that plays a big role. And then, of course, you can't get away from exams, unfortunately, with MRCP. With IMT, you have to, by the end of IMT 2, ideally, have finished all your MRCP exams. So that's MRCP Part 1, MRCP Part 2, and then PACES. And that's basically the written exam, and then you've got your Viva, which is the PACES exam. Like Mariam said, actually, it's really good to try and do some of those exams. Ideally, if you can, in the next 6 months, you can aim to do maybe MRCP Part 1, so that when you get to the interview, you actually have that to talk about, and that shows your commitment to the specialty. Because really, when the people are interviewing you, they're looking for someone who's competent, they're looking for someone who's safe, but they're also looking for someone who actually wants to be a medical doctor, a medical trainee. A lot of people apply to IMT because IMT doesn't have an exam you have to do before you apply. So you don't have to do, the MSRA, you don't have to do that. So often it's quite an easy specialty to just submit an application to for, just to maximize your chances to get into training. So they want to identify the people who are actually passionate about a medical specialty and want to do it. And completing your exams is also quite nice. So just to finish off, how do you actually make the most of IMT when you're in it? So really, it's about leaning into the opportunities you have to learn. So there's a lot of opportunities to engage with training days, regional training days. There's a lot of fantastic doctors you can learn from, really excellent teaching. There's some really great neurology teaching. I mean, neurology is something that I used to struggle with at medical school, but actually I've come to really enjoy. And it's all about like leaning into the learning opportunities available to you. There's a lot of niche specialties in the medical specialties, so like there's sports and exercise medicine and genetics as well. Like there's a lot of subspecialties that you may not even know about. So have a look and see what specialties are, and if there's something that piques your interest, lean into it, learn a little bit more about it, and then that way you have something to talk about in your interview. And overall, I think just have a positive outlook. Don't get clouded by a lot of the negative things that people might say about IMT. I think a lot of people maybe have negative experiences with it. It's really what you make of it. And actually, if you look at the opportunity in internal medicine training, you will actually find a lot of value in it. Lean into the specialties that you're doing at the time and try to make the most of it. So yeah, I hope that was helpful, and I hope that kind of gave people a little bit of a positive spin on IMT. I'm happy to take any questions. Perhaps I should stop sharing my screen. What do you think, Ramla? Should I? I think there's a few questions probably. Let me. How do
Yeah,
I
that should be
stop
fine.
sharing? Stop share. There we go. Amazing. Yeah, happy to take any questions if anyone has any. To myself or Mariam, to be fair, I think if you guys have questions for Mariam as well, that's probably more helpful at the stage you're in. A good question, actually. That's a really, really good question. So do you have to complete MRCP before applying for Group 2 specialty? So you don't have to finish MRCP before applying, but it does increase the number of points. So again, the whole process starts again, unfortunately, when you apply for higher specialty training. And there's a number of points allocated to how much of the MRCP you have completed. So you get a maximum number of points if you've completed the whole MRCP by the time you apply. But realistically, you only need to have completed it by the time you finish IMT2. So you have the whole of IMT2 to finish it. Preferably before you start IMT3, you need to have finished, or ST3, which would be ST3 in the Group 2 specialty. You have to have finished your MRCP, but you don't need to do it before you apply. But it just maximizes your chances, basically. I hope that answers your question.
Sorry, Zainab. Zainab, is Zainab around?
Yes, yes, yes,
Yeah.
yes.
Um, Sorry, not Zainab, Ramla. I think previously
Oh, Rana.
someone. Oh yeah, I think previously someone asked. I have just checked the chat. Someone
Yes.
said that they didn't do F1 and FA2, and have they applied have do they apply the IMT or something like this, isn't it?
Yes, yes, that's right.
Oh yeah, because I didn't get the point. To apply for IMT, guys, you need to do F1 and F2, because if you didn't do, you are not even safe doctor. I don't think that support worker. It's my first time to hear that. I'm not sure. Sorry, that support worker. I don't think it counts that F1 and F2 or medical support worker. Anyway, so guys, you have to do internship. Is mandatory 100%, because you if you don't do F1 and FA2, you are not a safe doctor. You can't on an IMT. What they are looking for is IMT year one. They need someone to lead for F1 and FA2 in a ward. So I don't think it's safe, and I don't think you can even apply if you do a medical support worker and stuff like this. You have to do internship is mandatory, especially FY1. It's they need like foundation program is more important, because it will show that you understand everything to be a safe doctor. So that's, I want to clarify that point. All right. Uh, that means yes, it counts if you do back home, if you do audit, a presentation, teaching back home, that's fine. I did some in Sudan, so it counts. It's not just mandatory in UK only.
Right. Useful. I learned a lot of IMT training as well. And